Welcome to Straight from the Source from FMOL Health. Here, healthcare is a verb. It's how we show up every day, boldly, joyfully, and with great love. Today, we're excited to welcome Dr. Shaun Kemmerly, Chief Medical Officer at FMOL Health, Our Lady of the Lake Children's Health. Welcome, Dr. Kemmerly. We're so glad you're here.
Well, thank you so much for being here.
Thanks, Stephanie.
I cannot believe I have hosted podcasts for the health system since 2018, and you have never been a guest.
I guess I've been able to hide for that long.
You have. But I am so excited that you're here today. So we'll just start with, just tell us a little bit about yourself.
So I am Shaun Kemmerly. I am the CMO and interim president for Our Lady of the Lake Children's Health. I'm a pediatrician by training. I practiced general pediatrics for 15 years in the community. So I've been on medical staff at Our Lady of the Lake since the early 90s. Then in 2006, we started a pediatric hospitalist program at the lake. And so I started that with Dr. Crapanzano and a few other leaders. And that was a lot of fun. And at that point, I really became involved every day, many hours a day at the lake. And it was great to really grow that program. And then in 2011, when the organization committed to building a freestanding children's hospital, at that point, they were beginning to look for a CMO. So in 2013, I stepped into that role. And it's just been an amazing career since then. Just really fun, learning about children's hospitals, interviewing different architects, all the detailed planning of this beautiful building that we were gifted by the sisters that we built in 2019. So we've been in our new home for 6 years. It still feels like yesterday, and it looks amazing.
Just the day we opened it.
Yes.
When we were opening it, I remember the stat of this was the first children's hospital built in Louisiana in 40 years.
Yes.
So it kind of leads to my next question about pediatric healthcare, just kind of in general in Louisiana. But I think your comment about the sisters, and we'll get into why the mission of all of this, but it truly was a gift of the sisters to invest in something like this, to allow the health system to go in this direction when a lot of other health systems aren't investing in these areas. So it was a pleasure to open it, and I'm so glad it's still shining.
It's amazing. It's wonderful to have in our community. It's wonderful for Baton Rouge, but also the state and just the region. And it's been exciting to have it grow and all the programs grow.
Yeah. Well, tell me a little bit about just the state of pediatric healthcare. We can talk Louisiana, Mississippi, but also Gulf South. Kind of, you hear a lot of scary stats sometimes, but tell me about your perspective on that. And if it's not so great now, what are we doing to really turn that tide?
You know, it's interesting. It's kind of disappointing, but healthcare for the Gulf South is not good for pediatrics. There's multiple healthcare reports, and they all show Louisiana, Mississippi, Alabama often on the bottom, whether that's to do with infant mortality, preterm births, poverty, access to healthcare, literacy. Like, we are struggling on many of those items, and we have been for many years. I think it's going to take everybody, multidisciplinary, local government, community leaders, businesses, healthcare, education. Everyone needs to work together to move that needle.
Yeah. Where do you see our health system stepping in to bridge that gap?
We've done a lot, and we'll continue to do a lot. I think one of the really interesting, innovative things that we've done in the past few years is joined and partnered with Manning Family Children's in New Orleans. That's been an incredible relationship. Like, pediatric healthcare is hard enough, and the children of our state need us to work together. And so let's not be competitive, but let's work together to improve access to pediatric specialties that are so hard to recruit for. And let's build programs together. So that's been wonderful to do.
Yeah.
And then we have other good partnerships, some smaller type of programs with the Joe Burrow Foundation that has connected us with Nationwide Children's. And so we have partnered with them to be able to care for children through our healthcare centers and schools. So we treat kids in schools and make sure that we're meeting their mental health needs as well as their medical needs.
Mm-hmm. It's so interesting. The more you kind of peel back the layers of the onion of pediatric healthcare, you see it's not just hospital care. It's schools. It's teaching families how to eat healthier. It's food deserts. It's all those other social drivers of health that really impact kids. It's school attendance. It's all the things. And so tell me a little bit more about kind of how we are expanding those programs or that access to more kids in Louisiana and Mississippi.
Yeah. You're right. The hospital is really just the tip of the iceberg. Healthcare occurs in the family, in the homes. That's where it starts. Local access to your pediatrician. You know, it's interesting. The American Academy or the American Board of Pediatrics, they track the number of pediatricians in the United States and then as well as for each state. And nationally, there are about 82 pediatricians for every 100,000 kids in the U.S. In Louisiana, we have lower amount of pediatricians. We're more like 69 pediatricians for every 100,000 kids. Mississippi's even lower with 50 pediatricians for every 100,000 kids.
Wow.
So we need more pediatricians to help improve access to care. So that's one of our initiatives is to recruit and retain great pediatricians and great pediatric specialists. Since I've, like in the past maybe 5 years, we've hired over 90 pediatric specialists and general pediatricians for the greater Baton Rouge area, which is a lot of welcome lunches and recruitment dinners. But it's been so great to be able to share our story. And I really feel that the Freestanding Children's Hospital has helped us recruit because it shows candidates that we are committed to making a difference in pediatric healthcare in our community. That the organization is behind us 100%. And that helps people come. They want to be part of the team that's trying to impact 50th score on the pediatric health report and help us move that up.
Tell me why having a pediatrician relationship is so important for a family.
As a pediatrician, I think that relationship is incredibly important. We're your partner in raising your child. We want to be your partner in raising your child. It's been just a precious relationship that I have had with many families. Everything from, what is this rash to, oh my gosh, this is fever, or is this freckle anything that I should be worried about, or vomiting, spitting up. It's little things to, I've had this limp and, oh yes, this is something more serious, or I have this mass, this is serious. So you really are part of the family. I kind of realized it one day when I was doing my general pediatrics, a little patient that had followed for a long time, she came to see me and she brought me her baby book, and I was in her baby book. There was a picture of me like with her as a newborn. So it's just the sweetest thing. You get school pictures, you get graduated invitations to their high school graduation. It's a really special relationship. So we want to be there for families that are making little decisions to bigger, scarier decisions. We're your partner.
Yeah. And having those partners in places that are underserved in those rural communities or across the markets we're in is so important, because not everybody can drive in an hour to a pediatrician, don't have the means, or would have to even drive further if we don't continue to add more.
It's true. Looking at the parishes in Louisiana, there are 21 parishes that do not have a pediatrician.
Wow.
And so that's just over 30% of the parishes do not have a pediatrician. So those families are traveling sometimes up to 2 hours to get their basic pediatric care. And that's a challenge. There's transportation challenges. That's time away from work. There's so many barriers there that we need to improve. I am excited about our pediatric residency program.
Tell me about
that. 15 years ago now, we started the pediatric residency program. It's Our Lady of the Lake sponsored program. We take 12 residents a year. and they're with us for 3 years. So these are bright young physicians that have completed medical school. They're with us to train in general pediatrics. About half of them come from the state of Louisiana, and the other half come from outside the boot and enjoy our Southern hospitality. And after the 3 years, about half stay in general peds, and then the other half will pick a specialty. And that's been incredible. We've been able to place general pediatricians in communities such as Walker, Livingston, Ascension, Monroe. This year, we have 2 of our graduating general pediatricians that will go to Eunice, will go to Lake Charles. So that's making an impact to those communities that have more difficulty recruiting and retaining general pediatricians.
That's great. Yeah, the residency program is really a shining star, I think, in the universe of pediatric care. And I think the growth of academic medicine and what that means to our health system is something we're going to continue to tell the story about, because I think people have a lot of different expectations or understandings of what that means and the impact being an academic medical center can have, and that extends to the ped space as well.
Oh, absolutely. We are looking to start our first fellowship. So after your 3 years of pediatrics, if you want to be a specialist, that's another commitment of 2 to 3 years of training. And so we are exploring to start a hospitalist fellowship, so training pediatricians in hospital medicine, so learning to take care of kids in the hospital, so more intense illnesses, meningitis, pneumonia, diabetic ketoacidosis, things like that.
Tell me a little bit more about some of the other expert level care offered in our health system for peds. Trauma, surgery. What else are you proud of?
Let's talk about trauma. We are a verified level 2 pediatric trauma center. When we moved into the hospital in 2019, we were seeing about 350 traumas a year. Now we see over 1,000. So we've more than tripled the number of traumas. I'm so proud of our team. The emergency room doctors are just excellent. The pediatric trauma surgeons are amazing. They respond to the hospital within 15 minutes for a level 1 trauma or that sickest trauma patient. And they are here. They are in the hospital, ready to go. We have our OR team that is in-house 24/7, ready to take a child to the operating room as needed right away.
And that's a differentiator, because not all hospitals have either the intensivists, the trauma surgeons, or the surgeons in-house, which means precious time.
That's right. And that is the differentiator. Time, those first few minutes make a big difference. So we have that availability to impact the child's care emergently. And the team is fantastic. They are so skilled. And we've just seen that team work together and be able to work together seamlessly to provide that life-saving care has been incredible.
Yeah. Well, what about robotic surgery? That's an exciting kind of growth area for us, I think.
That has been very cool. We started robotic surgery in December, so the pediatric surgeons are doing robotic surgery. Some of our surgeons have gone to go do extra training because it's been several years since they've done it. So they've gone back for a refresher course. Some of our newer surgeons have just jumped right in with it. But they are excited to do it. And then they are teaching the surgery residents that follow with them and rotate with them on service. It's important to be able to share that cutting edge technology with the young and upcoming doctors. The surgeons will, they've talked about doing the impact of robotic surgery. There's some difficult cases that they'll describe that maybe a child had a surgery and then a couple of years later needs a redo. And with that scar tissue, it can be very challenging, and they're able to perform better, with more expertise with that robotic surgery.
More precision. We also had a new addition to the imaging area. What is her name?
Well, a children's hospital, we have to have fun. So we got a new 3T or 3 Tesla MRI. So we had a naming opportunity at the hospital, and we voted for Mariah Carey is our latest addition to the team. And she's beautiful and very fast. And our neurologists really love her. Our orthopedic surgeons love her because she does great imaging of brain tissue as well as soft tissues. So orthopedic soft tissues, she can really exemplify and show great detail. Since adding this 3T MRI in last July, we've really been able to decrease our wait time for elective sedated MRI. Certainly, if you need an emergent MRI, we're there for you. But sometimes there are just other ones that are elective and they don't need to be done emergently. In the past, we had about a 10 to 12 week wait to have that sedated MRI, and now we're down to 1 week.
Wow. That's access.
It's big.
That's providing more care to more kids who need it at the time they need it.
Exactly. It's the right care, the right time, the right location, providing access closer to home so families don't have to travel, they don't have to miss as much work. The kids don't have to miss school, helps with literacy. It's all woven together.
Yeah. Well, so as part of our whole health system, we actually have 2 children's hospitals. We have Our Lady of the Lake Children's Hospital, and we have Our Lady of Lourdes Women's and Children's. We have pediatric presences in Monroe, a little bit in Jackson. Talk about how we work to kind of provide care across all of those areas, trying to keep the families as close to home as they can.
Absolutely. We connect with the pediatricians throughout the health system. We share educational ideas. We have protocols for standard care of how do you manage asthma, bronchiolitis, skin, soft tissue infections, et cetera, community-acquired pneumonia. And we share those protocols so that we're all doing work the same way. We have a transfer center that has been in effect for several years, but we've recently revamped how we are transferring patients so that if someone calls from Opelousas and their need can be met in Lafayette, that's the closest to that family's home. That's where your child needs to be. If it's a service that can't be provided in Lafayette, then we'll bring them to Baton Rouge. So it's all about working more closely as a health system, providing the care for patients where needed.
All of this for kids, incredible trauma care, expanding pediatrician access, MRI machines, it all costs money. And caring for kids can sometimes bring greater investment and cost because of the specialized nature of what that brings. So tell me a little bit about why investing in all of this is so important and how you feel our health system is meeting that need.
It's true. Pediatric care is expensive. We have to carry equipment and supplies that take care of little infants all the way to a big 17-year-old, football player. So it's a lot. And reimbursement for pediatric care is not as strong as some adult medicine programs. It doesn't matter. Our mission is to take care of children, and we go where we are needed. And I think that that's been just a message from our sisters for decades. The FMOL sisters have been in Louisiana for over 100 years. They have been taking care of children since then. We really credit Sister Julie back in the 40s as recognizing that kids were different and not little adults. And she was the first one that created kind of a pediatric ward. She also stressed that play is necessary in healing. So she was our first child life therapist. And I feel like we have just continued on that mission of the sisters. So yes, pediatric healthcare does not make a lot of money for the system, but it's what we are about, and it's important to us to care for our community. And of course, the children are the most important part of our community, and that's where we put our efforts.
I think we talk a lot about what makes FMOL Health different, what how do we healthcare differently? And I see pediatrics as a big piece of that, and that where other health systems may shy away from things that cost too much or aren't as popular or trendy. Since the 40s, we have been focused on kids and the importance of that, and really never wavered in that commitment.
Right. We take all patients regardless of your ability to pay. And it's hard to recruit pediatric specialists. They're short. It's a shortage.
Mm-hmm.
And so by building this hospital, we are committed. By recruiting the pediatric specialists, we are committed. Mm-hmm. By expanding our services, it's just a testament to the community of our efforts in pediatric healthcare.
Do you have any stories that really kind of illustrate recent additions or patients or providers that really kind of show good things that are happening in pediatric healthcare?
That's kind of a tough question because there's so many good things that happen in pediatric healthcare. I do want to brag about our ENT team of physicians and providers. Lauren Buck is amazing. Lisa Morris, absolutely amazing. Laura Hetzler, Belinda Mantle, Dr. Hanby, several. Dr. Buck is a superstar. I would say that she is the most talented, skilled pediatric otolaryngologist in the state, if not the region. She is a local Santa Maria high school girl who trained at Cincinnati Children's, which is the most prestigious place to train for pediatric ENT, and she wanted to return home to take care of her community. She has performed numerous surgeries on complex airway and reconstruction of airways for little bitty newborn babies or premature babies that can't breathe. And it is truly miraculous what she has done for kids in our community. She has saved multiple lives, and she's just added to the strength of our hospital and our program.
Yeah. Shout out to Dr. Buck. That's awesome. Looking to the future, what are some of the biggest opportunities you see to advance pediatric healthcare across the Gulf South, not just here?
Well, access is absolutely, we will continue to recruit and grow our residents and move in that direction. We are excited to be working on mental behavioral health. That is a challenge not only in pediatrics, but in the adult population as well. We currently are undergoing a mental behavioral health retreat with our pediatric team, psychiatry teams, LSU psychology, Ascension mental health group. We've got a multidisciplinary group that are meeting. What can we learn from each other? Where do we have gaps? How do we work more closely together? That's super exciting. Another program is our weight and nutrition clinic, which we started about a year ago. And that multidisciplinary team of providers, nursing, dietitians, social worker, really working with children and families to help educate on better food options, exercise. There's medications now that help. And our next step is to start bariatric surgery on adolescents who have maximized all of the medical care. And that's something that we'll be starting this year. So that's exciting. On our neuroscience front, we have our EMU or epilepsy monitoring unit that we started last summer. So that is helping us take care of complex children with epilepsy, being able to wean medication, maybe get them off of 6 medications down to 1 so that they have fewer side effects and better control of their seizures. And then the next step of that is to do epilepsy surgery to try to eliminate seizures altogether. That's very cool. Orthopedics has continued to grow and expand. We've added 2 new orthopedic surgeons in the past year and a half, and we partner with Brock or Baton Rouge Orthopedic Clinic. Right now, with the addition of the surgeons, children don't have to wait. Like they are able to get an appointment within a couple of days. And that team has done amazing things with complex spine surgeries that we're really proud of, as well as hip preservation surgery. So they are very talented and growing. And then I guess lastly, I'll talk about our cardiology team. Pediatric cardiology is growing, and our partnership with Manning Family is really prevalent there. We are able to, through that partnership, we're able to have pediatric subspecialists. So yes, you're a pediatric cardiologist, but you also have special training in electrophysiology. And so those types of specialists are coming to our clinic, embedded in our clinic here in Baton Rouge, and offering that specialty care to kids here.
Yeah, that's amazing. That's a lot.
It's a lot to look forward to. It's fun. It's every day is something fun and exciting. We've got lots of balls in the air, but we've got an amazing team that's moving forward.
What that says to me, as you kind of list off those investments in those incredibly specialized growth areas, is that the future of pediatric healthcare in the Gulf South is brighter because of what we're doing here today.
Absolutely. We're doing amazing things. That needle is going to be hard to move, and it's going to take everyone doing amazing things, but we are really trying to work together with partners to do our best for children.
Well, one of the personalities of our brand is joyfulness of spirit. So it's not only a pillar of our brand platform, but a core value of our health system. So tell me a little bit about what's bringing you joy these days. It doesn't have to be work related, but what's bringing you joy?
There's lots of fun things. At the hospital, we dress up every day. Grandbaby on the way in April.
This will be
number 5.
Number 5.
And they are wonderful and fabulous. I'm looking forward to a trip this summer to Glacier National Park with our family. So excited about that. And my youngest child just got married last month. So there are tons of fun things going on.
Well, we also say that we do all things with great love. What's something you've seen recently that made you really feel the heart of FMOL Health?
This happens every day. We had a child come into the emergency room with a gunshot wound yesterday, and that child passed. And that was the second child that passed from a gunshot wound in a 48-hour period. These are young children. Our ER team is amazing and so compassionate. So we're also a young team, and it's challenging for our teams to be able to process that type of trauma, but then also be there to support the family. Yeah. And we hear story after story. The doctor stayed late to help support the family. The nursing team went out of their way to be compassionate. The security guard stays longer. It's everyone bending over backwards to make it better. For our trauma program, in learning more and more about pediatric trauma, we are aware that the Baton Rouge community has a higher than the national average incident of children suffering gun violence. Yeah. So much so that this has prompted one of our pediatric neurosurgeons, Dr. Jill Plouffe, to really take a stance. She feels called to do more. And so she is working with local leaders and legislators to propose House Bill 220, which talks about limiting access to loaded guns that are not secured for children. So it's something
you would think
we're not talking about hunting or right to own a rifle or a gun. It's just if you have a gun in your possession and it's loaded, please keep it secured so that a child can't harm themselves with this gun. And I think that's part of the special, that speaks to the type of providers that we have that are trying to go above and beyond.
They're not just treating what's in front of them. They're looking at the bigger picture of, let's go upstream on this a little bit and see how can we stop more of these traumas from happening in the future.
Right.
That's incredible. Well, if there's one thing you hope the audience remembers about this episode, what would it be?
I really want to thank people for their support of the Children's Hospital. When we first opened the hospital, it was like we had an open house in October of 2019 on a weekend, and it was a very hot weekend.
It was a heat wave.
It was hot. People waited in line outside. They snaked through the parking lot for hours to come inside and tour the Children's Hospital. That made an incredible impact. This is not a children's hospital. It's not for us. It's this community's children's hospital. And people have just generously given so much of their time and skills and talents, and they'll volunteer with us. They've donated towards projects that we have, and we can't do this work without them.
I love that it's for everyone.
Yes.
Not just us. Well, this has been one of my favorite episodes because I just love sitting to talk with you and I miss doing that.
So thank you so much for your time, and I can't wait for everybody to hear it.
Thank you. I appreciate the ability to talk about our great team and the work that we do and how we want to continue to grow.
Thank you.
To our audience, thanks for tuning in. We'll have helpful resources linked in the show notes, and we'll be back soon with more episodes of Straight from the Source, a podcast from FMOL Health. If you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org.